I live in Israel and my clinic is in Tel Aviv. We have a lot of sun and a lot of sun exposure, and many people suffer from a lot of sun damage. So they have a lot of wrinkles, a lot of sunspots, a lot of solar lentigines, and actually they all need some skin resurfacing. So they will come and they will say, what can you do to rejuvenate my skin, to make my skin look younger? I want to look better, to have a smooth surface, to have an even skin tone. What can you do? I propose to many patients the AcuPulse. And the reason for this is that I can give with one treatment, with one CO2, fractional CO2 treatment, tremendous results, fantastic results. They will stay 5 days at home, so the downtime for patients nowadays with the CO2 is 5 days. And after 5 days, they actually peel. There is kind of a peeling of the skin, and they will have very nice skin. So they're actually quite happy about it. Mostly patients will ask for facial rejuvenation, but the great thing about the AcuPulse is that I'm also using it off the face. I'm using it also on the neck and on the décolleté. When I'm doing the facial rejuvenation procedure with the AcuPulse, I will also always treat the neck. I'm using then the superficial mode, and it's very nice. Patients like it very much that they're getting also the neck treated. Also, this is something that we couldn't do in the past. As you know, when we were doing the ablative rejuvenation, the ablative resurfacing, we were nearly not treating the neck because of the risk of scarring. We don't have it now with this new device, with the superficial mode. I'm using the AcuPulse in my clinic for several years. And compared to other CO2, fractional CO2 lasers, it has a much better ablation versus coagulation ratio. So relatively there is more ablation and less coagulation, which is very good for fractional ablative resurfacing, because in this way we can treat deeper wrinkles without the risk of side effects, because you're really going deep without getting too much collateral heating on the sides. So which means that actually we get very nice results at lower energies. Already at 30 millijoules per centimeter quadrant, we get 1 millimeter of depth, which is the right depth to treat wrinkles. So you actually don't need more than that. So you already get the depth at 30 millijoules. And on the other hand, you don't have so much collateral heating, so we don't have side effects. Side effects that can be seen are late hypopigmentation, actually delayed hypopigmentation. I've seen it with other fractional lasers, and I haven't seen it with the AcuPulse. And for me, the reason for this is this ablation coagulation ratio, which is great, using lower energies to get fantastic results without risking any side effects. The other problem with the other fractional ablative lasers is actually the downtime that patients get. So because we're using lower energies, we actually get a little bit less inflammation, a little bit less redness, and also the period after the resurfacing, after actually finishing the 5 days at home, they will have less redness. So their skin will be just a little bit pink, but not red like with the other devices. So actually healing is faster and less risk for side effects. Safety margin is higher up, and it's very important to be safe. So you're deep on the one hand, which is great to get fantastic results, and on the other hand you're very safe to not get the side effects such as the healing time, which is quite long with other devices, or a little bit longer, and also the safety for long-term side effects, such as permanent and delayed hypopigmentation. On our M22 platform, we have the IPL, we have the Resurfix, which is non-ablative skin resurfacing, and we have the long pulse Nd:YAG. In our daily practice, the modalities that we use the most are the IPL and the Resurfix. As you know, my clinic is in Tel Aviv, in Israel, and most of the patients that come in will have spots. So we have a lot of solar lentigines due to quite light skin types, a lot of sun exposure, and actually also a lot of wrinkles, a lot of rough surface of the skin. So these patients, they ask to remove the spots and to have a smoother skin. And if I want to treat this, I actually would like to combine the IPL together with the Resurfix. So I will do the IPL first to treat the spots, and at the same session I will use the non-ablative resurfacing to actually get a smoother skin surface, to treat the smaller wrinkles. And patients like it. Patients like this also because there is no downtime with these procedures, so they love to come and do it. They don't have any downtime and the results are fantastic. So I'm using the long pulse Nd:YAG for vascular abnormalities. We've used it for telangiectasia on the skin, on the face I've used it. I used it a little bit for leg veins. But most of our patients, I have to say, they come for facial rejuvenation in our clinic. So yes, I can use it on the face. It's very nice, very effective. Sometimes just one treatment is enough and they are really, really happy. Comparing ablative and non-ablative resurfacing in the clinic. So most patients love non-ablative treatments. They love them because they don't have to stay at home. And I have to say that something has changed over the years with our patients. First of all, we have more patients, so a lot of people are coming for treatments. But most people don't want to stay at home. And I have to say that also many people are afraid of ablative resurfacing. So we are doing a lot of non-ablative treatments and actually not so many ablative treatments. I mean, we're still doing ablative treatments mainly in the winter, and you know in Israel winter is very short. So we do those treatments, but it's not like 10 a day. It may be 1 or 2 a week. While non-ablative, we can do like 5 a day, or I mean, we can do really, really many of those treatments. So non-invasive body contouring is a whole new field that is coming up. Up until a few years, we just had invasive body contouring, liposuction, and I mean surgical techniques. And nowadays we have more and more non-invasive body contouring technologies coming up. The 3 main technologies that we have are ultrasound, and the SlimMe is an ultrasound technology device. We have radiofrequency technologies, and we have cryolipolysis, which actually treats fat by cold. So both radiofrequency and ultrasound technologies heat tissue, so we are actually treating the fat cells, destroying fat cells, leading to fat cell death by heat, by heating tissue, and cryo is of course doing the same by cold. So when comparing the SlimMe to other technologies, we can say that it is very easy on the patient. So patients like this treatment because it's short, they can tolerate it very well, so they do feel the heating of tissue, but there is no pain. They tolerate it very, very easily, and it's quite fast. It takes less than an hour to treat a whole abdomen, so patients are happy. Also, another point is that it is just one treatment. So my experience with the other technologies, mainly radiofrequency technologies, that heat tissue slowly, is that patients had to come back many times. So they need like at least 3, sometimes 6 treatments, sometimes even more to get a little bit of result. So here you have just one treatment, which is very efficacious. Regarding efficacy, this is also very interesting because you can see some results already few weeks after the treatment, but the real result, I mean, most of your result will be seen after 12 weeks. So after 12 weeks, patients already see reduction of up to 4 centimeters in the abdominal circumference. The mean abdominal circumference reduction is around 3 centimeters. So most patients can have 3 centimeters reduction, which is very nice and also very comparable to all the other devices, because all non-invasive body contouring technology devices will give up to 4 centimeters circumference reduction of the abdomen. Now, regarding the mechanism of action, how does it work, the SlimMe? it's very, very interesting because ultrasound waves actually can induce heat in our tissue. So the SlimMe is a high frequency ultrasound device which heats tissue, heats fat tissue very, very fast. So already at 96 seconds we reach the desired temperature of 48 degrees. And this desired temperature will be kept for about 3 minutes in the tissue. And this is what we want. We want a fast treatment that will heat tissue to a certain level, to 48 degrees, and for the temperature to be there so that we can induce cell death. Now, the induction of cell death is very, very important to be efficacious. And this is the reason why this device is efficacious in the treatment, because we really destroy fat cells, we kill them. Although they die quite slowly, they are still killed.